A pap smear test is a procedure to test for cervical cancer in women. It involves collecting cells from the cervix. Starting, explain the procedure and ask for patient consent.
Shamers kan diyan ko ug sa karon kay magbuhat ko pap smear sa imo ha. So naara ko i-insert na speculum. So medyo sakit ni siya pero maagwanta ra man nimo ang kasakit. So kani siya importante ni siya kay tan-awon nato kung nabay mga depekto sa imuhang mga cells sud sa vagina. So okay ra ba ma'am kung examine din ti karon? Sige ma'am, okay ra. So ato lang tika i-position ma'am og tarong.
Place patient in a dorsal lithotomy position. Observe aseptic technique by putting on gloves. Choose the appropriate speculum for the patient and put on some lubricant. Facilitate the insertion of the speculum by spreading the labium with your thumb and index finger. Insert the speculum by placing the transverse diameter of the blades in the antero-posterior position and guiding the blades through the introitus in a downward motion with the tips pointing towards the rectum. Once the blades are inserted, the speculum should be turned so that the transverse axis of the blade is in the transverse axis of the vagina. The blades should be inserted to their full length. Once the cervix is visualized, the speculum is opened and the introitus widened. This can be done by using the screw adjustment on the base of the speculum. Inspect the vaginal canal. The vaginal epithelium is noted for evidence of erythema or lesions. Cervix is inspected for erosions, shape, the transformation zone, and lesion. Sample the cervical canal with a Cytobrush, which is placed into the canal and rotated. The material obtained is then smeared thinly on a microscopic slide by the rotation of the brush on the glass surface. This should be labeled Endocervics. An iris spatula or some variation, the transformation zone is scraped. Sample is smeared thinly on a second slide, which is immediately fixed and labeled Transformation Zone. For fixation, a spray fixative or by immersion of the slide in fixative solution can be done. Remove the speculum by loosening the screws and enclosing the blade. Make sure to rotate the blade before removal. Do aftercare. Stain the slides and examine it under a microscope. Check for abnormal cells.